Hello, everyone. Thank you so much for taking the time to join us. Once again, from the Legislative Building in Regina, we have Saskatchewan's Chief Medical Health Officer, Dr. Shahab. We'll start with opening remarks from Dr. Shahab, and then we'll open it up for questions. Dr. Shahab?
So good afternoon. So I'll start with some opening remarks, and then I will show some slides to respond to questions that came up on Tuesday. So again, we have announced several other phases that are reopening today, and it is really important for all of us, business owners, but also all of us living in Saskatchewan, to read those guidelines, be familiar with those guidelines, so that we can all enjoy the summer and all the activities that are now open in a manner that keeps us safe, that keeps business owners and operators safe, and that keeps our case numbers low. And that, of course, includes staying home if you're sick, maintaining physical distancing when you're out and about, and frequent hand washing. There are also specific guidelines for people heading out to our beautiful parks and playgrounds, and so please be aware of them. We've heard of some gatherings that happen not maintaining the limitation to not gather outside of your household, and I think there's been some concern expressed regarding that. So it is important for us to maintain that discipline during the pandemic while we enjoy camping and recreation outdoors as well. Visitors who are going to Saskatchewan parks are encouraged to bring their own hand sanitizer and disinfectant wipes, and follow other rules that are in place. And of course, stay home if you're sick, and leave if you're not feeling well, and seek testing if your symptoms are consistent with COVID. Again, lots of people going to the beach on our warm days, and again, in general, people are complying with setting up towels and beach gear so that they're up to 4 meters away from other household groups. And again, if the sand area is full, move to a nearby grassy area or move down to another beach if the crowds are large. I think it's really important that we maintain that confidence to enjoy these settings in a safe way over the summer. In terms of cases, we've had 5 new cases to report today, bringing the total to 813. 2 of the cases are in the south, 1 is in the Saskatoon region, 1 in the far north, and 1 is in the central region. 48 currently out of the 813 are considered active. So our active case number is again coming down now, which is good. A total of 750 have recovered. Currently, there are 5 people in hospital, 2 in inpatient care in the north, 2 in Saskatoon, and 1 is in ICU in Saskatoon. So again, our hospitalization numbers are again now trending down, which is good. With that, I just want to walk through a few slides. And again, the numbers may not exactly match the news release. The slides always are made from data that may be a few days old, so please bear with us on that. But it is just to show some trends and some concepts related to questions that came on Tuesday. So as you can see, in March, April, that's the first peak. We had transmission mainly due to international travel. Then the middle peak, April, May, we had a few intense outbreaks, mostly in the northwest. And then on the smaller peaks on the right side, we will continue to see small peaks. Either it's a localized outbreak like in the southwest, which is now settling down, or small clusters. So we will continue to see this as we move forward. And I think our intent is to encourage people to seek testing if they're symptomatic, for public health to rapidly conduct case contact investigations, and for communities to participate. And I think in the past we've had concerns expressed from business owners when there's a public service announcement. Business owners shouldn't feel stigmatized that their name is in a public service announcement. Individuals shouldn't feel concerned, or community shouldn't feel concerned if they've been identified as a community with an outbreak. I think COVID is nobody's fault, and it will happen to many of us, and as we're out and about, and all we need to do is seek testing, cooperate with public health in case contact investigation, follow further direction in terms of staying home. And that is the only way we are really going to manage and come out of it. So again, I think there's lots of sensitivities now that we're open about cases being reported and public service announcements naming businesses. And we all need to respect the fact that, just because a business has a public service announcement doesn't mean that that business is unsafe. Everyone is really doing their best to comply with guidelines, but if someone visits a certain business and there needs to be public service announcement of there's a staff member who got exposed while at work or otherwise, and was at work while becoming symptomatic and then isolated, sometimes there is a need to inform people who may have attended that venue either through contact tracing, if, for example, there was a list of all people who had come, or through a public service announcement if that's not possible, certainly in grocery stores, other retail settings, and some restaurants where there isn't a list of all people who had made reservations with a phone number. So again, I think we just need to be calm about it, not stigmatize or point fingers at each other, because this will continue to happen for the next several months, and we just need to take it in our stride and accept that COVID is something as routine as getting flu in the winter. Of course, it can have serious consequences, but it certainly should not be a source of stigma for a business operator, for an individual, or for a community. So I just want to reinforce that. If we look at our number of lab-confirmed cases by age and gender, again, I think it's really positive that we are seeing testing in all age groups, especially in young adults and middle-aged adults who are more likely to be out and about and at work. I think we need to maintain those testing numbers across all age groups. And in terms of our cases, our cases are consistent with cases in Canada by age group, but we do have high number of cases in the younger age groups, and part of it is obviously due to very aggressive case content investigations in the Northwest by public health, and communities really stepping forward, where a lot of household members who were asymptomatic or were contacts were also tested. So again, just because the case numbers are high, especially as part of an outbreak investigation, isn't necessarily a bad thing. And all that means is there's aggressive case finding, and we find many more cases than we would have found otherwise. But then everyone is able to isolate and break the chains of transmission. So I think sometimes we obsess too much over cases in a particular outbreak, but they're partly a result of active case finding, and we shouldn't read too much into that beyond the fact that they are part of an intense case finding operation when there's a cluster or an outbreak. And similarly, when we look at who is going forward for testing, again, people in all age groups are going forward, but we just need to make sure that while if you're older, you're more likely to get severely ill, even if you're young and have mild symptoms and you're not really feeling unwell, stay home, seek testing, because, again, it's important to inform what you should do, and it's important to inform if you have close contacts what they should be doing. This is a really important slide for me to just pause for a couple of minutes. So we have to understand that, for example, we have 4 and 2 cases and contacts. We have contacts in excess of 6,000, so each case generates many contacts. In the PA area, for example, 6 cases have generated more than 100 contacts. And what we've seen is that each case is generating more contacts now because we're not in lockdown. But we do need to strive to keep a number of contacts as low as possible. So as we go out and about, if we were to become symptomatic, we should not be able to name a lot of people who were closer than 2 meters. And I think that's really important, because if our number of contacts start increasing, the risk of transmission starts increasing as well. But if we look at our cases, we can see that 288 of the cases were household exposures. So I think that's very important, that most of our cases were secondary close contacts of cases who may be exposed while in Saskatchewan or in another province or internationally. And then 114 were contacts to exposed in settings other than the household. 45 were exposed in mass gatherings. So those are numbers to watch, because if our number of contacts who are exposed in other settings or mass gathering starts increasing, then we have to understand that as we have opened up, what are the settings where maybe the guidelines are not specific enough and exposure is happening. And 31 were in the context of known cases. and also exposed in mass gatherings. And we have to recognize that we have very few people who we can't find a source of exposure. And right now in PA, for example, that those investigations are ongoing. But if our number of cases for which a known exposure can't be identified, that's another number that we need to watch closely, because what that will mean is that, again, we're losing the ability to control chains of transmission, and we just need to be conscious of that as well. Lower number of contacts and the ability to trace the exposure, not in all cases, but in most cases, is going to be really important. Symptoms, we've shown this before, but certainly even a cough or mild headache or sore throat, these are all reasons to seek testing. So there's a wide range of symptoms, and I think if any of these symptoms or any concerns that you may have been exposed should be a reason to call 811 and seek advice about testing. Risk factors, again, they remain the same as reported in the literature. Predominantly hypertension, diabetes, lung disease, heart disease, and others like immune suppression. We have to understand that there's been obviously increased number of cases in the far north because of the intense outbreaks in the northwest, and that has resulted in a higher proportion and number of hospitalization deaths, and that actually is quite sobering. And we have to understand that in the northwest, the communities, people living in the northwest, healthcare staff and public health staff living in the northwest, others who went to the northwest to assist, they worked very hard to get over those outbreaks. But that just shows that once there's an outbreak, it is challenging to contain, and there can be hundreds of cases and resulting in hospitalization and death. So the numbers are high in the far north, but they're consistent with what you would expect to see given their high case numbers. And in the north, of course, there was a nosocomial outbreak and additional cases and deaths, and now investigations in the PA area. And then hospitalizations and deaths have been fairly low in central, Regina, and south areas. But again, we saw a bit of a intense outbreak in the southwest. So these settings can change, but we just need to obviously understand that part of it is related to the number of cases, mainly so far due to localized community outbreaks. If we look at our ICU and hospitalization rate, again, I did show this before as well, but I think some figures that have changed is that we have seen now hospitalization in a person under the age of 19. We have seen hospitalizations in 20 to 39-year-olds, 7 total, and as well as 3 ICU admissions in individuals 20 to 39. So while people in this age group are less likely to have severe illness, it can happen, and proportionally this age group is also having more number of people exposed to COVID because they're out and about more. But I think we can't forget that even in this age group, you can have rarely hospitalization and ICU admission, and that is very concerning. And of course, older age groups, we expect to see more incidents of hospitalization and ICU admission. And again, for people who are hospitalized, again, the underlying conditions are very similar, but you can be perfectly healthy and still have a serious outcome. In terms of intubation and ventilation, again, while it's more common the older you are, but certainly we've seen intubation in the 20 to 39 age group, 2 instances. And again, while it's less common, it certainly can happen. And that's just something for us to be aware of in terms of our individual risk assessment as well. And the comorbidities remain the same for hospitalization and death. Our testing rates remain robust throughout Saskatchewan. And of course, they have been very high in the far north because of intense public health case contact follow-up and testing. They've been high throughout Saskatchewan in the north as well. But throughout Saskatchewan, they remain strong. But again, whenever there's a localized concern, like in PA or in the southwest, that's really a prompt for people to be aware of if they have any symptoms and seek testing early. We've seen a bit of an area of concern that the time between symptom onset and testing is increasing. So people seem to be delaying seeking testing, and the earlier you get tested, the earlier you can isolate yourself and your close contacts can be isolated. But of course, if you have any symptoms, you should yourself self-isolate till you sort out through 811 when and where to get tested. Don't wait for your test result before isolating. And this, again, is something that we are now tracking in a bit more detail. And this really, what this shows is that, we obviously say we have 830 cases cumulative. But what's now important to us is the last 2 weeks, because the last 2 weeks gives us an indication of what's going to happen in the next 2 weeks. So we almost live in this 2-week reality now, which we will continue to have to live for the next little while. So we had some intense activity in the Southwest, 4 weeks ago. That has settled down, so our rate of new cases is coming down. But of course, we have that cluster in PA. Small number of cases, but because they were hospitalized, that's the reason for concern. And those cases have generated 100+ contacts. So busy time for public health in the Prince Albert area. Proportion of active cases, again, it went up to 80+, has come down to a lower number. So again, that's good. Median time from symptom onset to self-isolation seems to be not coming down, so that's something for us to watch. Obviously, when people were coming from overseas, they were in quarantine, and they still are as per the federal quarantine guidelines. So they are in isolation. So if they are symptomatic, there may be 1 or 2 household members, and that's it. But if you're in Saskatchewan, you become symptomatic, you have to isolate and seek testing early, because that reduces the number of people who are exposed. Tests per 100,000 are going up, which is important, because that is important for case finding if we have clusters of concern. Our test positive rate is at the moment coming down, which again is positive. Our effective reproductive number is about, just above 1, a bit higher if there's an outbreak, but that is not that much of a concern right now, but something watched closely. We've had some recent deaths, so that our overall death rate has been low. Each death is a tragedy for the family and for the community. We have had some increase in deaths, but we have not had outbreaks in long-term care facilities. And again, the visitation policies have been relaxed a bit, but it's still critically important that if you're visiting anyone in a healthcare setting, especially in long-term care, don't visit if you're unwell. Go through the health screening, comply with any PPE requirements like mask use. I think that is going to be critical to protect our most vulnerable, especially in long-term care facilities, personal care homes, assisted living facilities, and others in hospital as well. And we know that if it's introduced in a hospital, you can give a significant nosocomial outbreak. We saw that in Lloydminster. Several other hospitals in Canada have had nosocomial outbreaks recently, and I think it's really critically important that we put introduction into healthcare facilities. And finally, there's lots of infographics floating around, and all have their strengths and limitations. But, I think one thing is that, right now it's summer, outdoors is better than indoors. Small rooms with lots of people crammed in a room with poor ventilation. I think that's something we need to be aware of. Right now, we can open a window. We need to think about how we'll manage in the winter, but it's something we need to be aware of. Crowds where people aren't maintaining the 2-meter distance, I think is something we need to be aware of. Having a mask on hand to put on, if you're not confident you'll maintain that 2-meter distance, whether in transit or while shopping or otherwise, is important. But generally, we should try to maintain that 2-meter distance. We generally have enough space anywhere we go to maintain that. It's just that self-discipline to comply with that. And, people have mentioned still that, they moved into a new house and neighbors came and they kind of offered their hand. So I was kind of surprised when I read that is that still happening? But again, people want to be kind and friendly, and there's ways of being kind and friendly right now where you maintain that 2-meter separation. So remain socially connected, but physically distant. So I think that's really going to be important for next, quite a while now. So I think we just need to get used to that. So with that, I'll stop. Thank you very much.
Perfect. Thank you, Dr. Shahab. We'll now open up for questions. We'll start with our first question on the line. Operator.
We have Brian Rogers with CBC.
Hi, Dr. Shahab. So the SHA is cautioning people about traveling to and from the Prince Albert area because of an increasing cluster of cases and because it's been difficult to contact trace there. I imagine a lot of people are, wanting to head out camping or heading to the lake in that area of the province. How concerned are you, and how concerned should people be about being in and around PA right now?
So I think generally we are going to see what's happening in PA all over the province. And what it generally means is that if you have a cabin or you've booked a campsite or you plan to go there with your family, by all means go, but just comply with those precautions about physical distancing, hand washing, not traveling if you're sick. I think that would be my recommendation, that if you have a cabin or you've booked a campsite, by all means go and participate in going at a restaurant or other activities. But certainly, if you're planning something, while travel within the province or interprovincially is permitted, recommendation is staying closer to home. And I think it's a busy time for everyone. But in PA, they have said that their population during summer goes up from 60,000 to 100,000 plus, and that's really good for businesses who rely on seasonal activities. And certainly, it's still safe to go there and just observe all the guidelines. But it's just that if you are traveling, just be more aware of what you're doing and avoiding all the things that I just spoke about. Crowded places, maintaining that physical distance. But if people have some underlying risk factors or concerns, they just need to be that much more cautious whenever there's an area of concern.
Do you have a follow-up question, Brian?
Yeah. So there's been a lot of debate, especially down south in the States, about politicians wearing face masks as a way to set a good example for their constituents who they want to wear face masks. And to my knowledge, there hasn't been much mask wearing by politicians for public events here in Saskatchewan. Do you think politicians should be wearing masks to set a good example?
So, I can just speak for myself, and I keep a mask. I have one in my bag right now as well, and I keep one in my pocket when I'm out and about, and I'll put it on when there's, when I'm not confident I'll maintain a 2-meter distance. And it's something we all need to get used to. I think all of us sometimes may be a bit, we need to learn the habit of having a mask and putting it on. And it applies to all of us. But I do want to say that, this is a marathon, not a sprint. We all need to have reusable masks for everyone in the household, more than one. We all need to have it with us when we're out and about. We need to put it on when we need to. But a lot of the activities we can do in the summer, we really can enjoy the outdoors without a mask safely. If you're on a beach, for example, or out for a walk, golfing, for example, a lot of those activities, you don't really need a mask, and so we don't have to fatigue ourselves by wearing a mask when it's not really helpful or required. But certainly in indoor spaces where you can't maintain the 2-meter separation, it's a good thing. And we have to look forward to the future. Summer is a time to be outdoors more, which is great. Winter will be moving indoors more, and certainly we need to think about how we will get used to wearing masks occasionally right now, and maybe wearing it more frequently in the winter as well.
We'll take our next question on the line.
We have Phil Tank with the Star Phoenix.
Yes, I'm curious about the I guess you're calling it a cluster in Prince Albert, and you mentioned that there was 6 cases there, but that I think you said that there were 100 contacts. I mean, why does that qualify for this? It seems a small number of cases to close hospitals and that, but I gather you don't know where the transmission. There's not an event where the transmission is connected to that you're aware of so far.
Yeah, so that's a really important point, and we have to remember that there's not just one indicator that we look at, and I'm just trying to get up the series of things that we kind of, for some reason, it's not stopping at that. There it is. So, if we can explain 4 cases, 6 cases, someone maybe traveled internationally or from another province or was exposed to another person somewhere, and then that person had 10 close contacts, household or otherwise, and 3 of them developed COVID. You have 4 cases. They're all explained. So obviously it's 4 cases, but they're all explained. If you have 4 cases in a geographical area after many weeks of no cases, but they're out and about in the community, no one is linked to one another, that's a bit of a concern. And if you have 4 or 6 cases from a geographical area like Prince Albert who are all hospitalized, it could just be coincidental that you had 4 cases only and they were hospitalized, But what that generally means is that because we need many cases to result in a few hospitalizations, we certainly want to make sure that we're not missing community transmission, and that's why public health is working with the communities to really understand how many people could they potentially have been in contact with, following those contacts up. So those 4 to 6 cases have generated 100 plus contacts, and like I said, our 800 cases have generated 6,000 plus contacts. And we are finding that as people are out and about, right in the beginning of March, each person had many contacts, 15, 20 more. When we went into lockdown, each person had very few contacts, and people who travel internationally also have very few contacts. But now we're finding as we're out and about, people are again having a lot of contacts. It becomes really challenging to complete the case content investigation, and that's just a kind of a reminder for all of us that even as we are out and about, the way we conduct ourselves should be such that we should be able to confidently say that, there were very few people outside my household or virtual bubble that I was closer than 2 meters from. So that's just a reminder for all of us.
Follow-up question, Phil?
Yes, you're probably aware of some of the conflicting science with respect to to this virus. And I'm talking specifically about the push to have it recognized as an airborne disease. I'm just wondering how you plan, your advice for the province. Do you take everything that's out there into account? Do you follow mainly the World Health Organization, Canada Health, or do you take everything into account? Like how are you building our plan for reopening and proceeding in this?
So the recent letter that was written to the World Health Organization, I'm familiar with that study and the letter. And actually there's no surprise there, because what they're talking about is the need for better ventilation. And that's important for us to think about for when we move into fall and winter, that when we're indoors, we need better ventilation, number one. Number two, I talked about it on Tuesday as well, that we know that if you are intubating someone in an ICU, you may be generating through intubation and suctioning an aerosol environment, so you need an N95 mask. We already know that in the healthcare environment, otherwise, wearing a procedure mask is actually really good, and we have seen very little transmission when healthcare staff are using the proper droplet and contact precautions. So those are not airborne precautions, they are contact and droplet precautions. And we've also seen when we're out and about that maintaining that physical distancing, suppressed the curve. And so we were able to control transmission because it is primarily transmitted through contact and droplet. If it was airborne, we would not have been able to flatten the curve the way we did. But having said that, if we were in a small room, for example, if this room had 100 people doing some vigorous physical activity, less than 2 meter separation from each other, and there was a fan in the middle, running away, of course, if someone is infectious and exhaling and breathing heavily, those droplets are going to swirl all around. So you have to space yourself out. You have to have good ventilation when you're indoors. And similarly, if people are sitting quietly in a bus or transit, that's one thing. If people wear a mask, that reduces further transmission. But if people are talking to each other and they're not part of the household and they're less than 2 meters away, that's an issue. If people are singing and they're not 2 meters away and they're in a poorly ventilated, closed environment, that's a higher risk. So I think those are the principles we need to be aware of and care about all the time. So, that article has raised some good questions about improving ventilation in indoor environments, not just in the summer where you can open a window, for example, but in summer, but in winter also, where some of those considerations would be very important when there are groups gathered indoors.
Next, we have Stephanie Taylor, Canadian Press.
Dr. Shahab, when can we expect to see some guidelines for larger gatherings for, say, maybe something sporting events or just anything kind of larger than the current limits we have now?
Yeah, so we are obviously looking at other jurisdictions in Canada and internationally. I think right now we want to be really cautious. I think gatherings in static events where you may be watching a show or a movie are capped at 150. We really want to be comfortable that the routines are set up so that we are safe at that level. We already know that indoor or outdoor gatherings where food is being served are even smaller at 30. And we already know that even as things are opening, transmission happens in the most mundane of settings. transmission happens when you're with friends and family who aren't part of your virtual bubble. You're really, we socialize around food, drink. We like being close to one another, and that's how transmission happens. So we still have to pay attention to all those routine things that we do and do things a bit differently. Will we go higher than 150? And that's the part of the phase 5. I think we need to, first of all, watch how successful we are once phase 4 is fully open and see what other tools we can use. For example, some provinces have deployed proximity tracing apps that lets you sort out, because if you're sitting in a cinema hall, maybe you can actually track who is sitting around you, but most people would be 2 meters away if they're not part of your group who went to watch the movie. So that wouldn't be an issue. But if you're in a large event, there may be some choke points, like when you're entering the building or when you're buying concessions or going to the washroom, where you really wouldn't know who you passed by or were closer than 2 meters to. And if you're wearing a mask, the risk is lower. I think we need to understand some of those issues when gathering sizes become larger. Certainly in some provinces, proximity tracing apps have been used, and we're trying to see how useful they are. They're not the answer in and themselves. But we need to be comfortable that if we were to increase the gathering size, if someone is symptomatic and at an event, how can we quickly let others know? And letting the whole entire group of people who went to an event is one thing. Having the ability to say, okay, maybe these people sitting around someone were more at risk, I think is more important. So I think we just need to see how businesses who are now opening up as per the guidelines can safely conduct events that are bigger, up to 150 in some settings. Be comfortable that those are not settings where transmission happens, and also understand that even when some of these new guidelines are there, how you interact with vendors, for example, is going to be different. You don't want things being handed back and forth. You don't want maybe the same pen being used. Even at a food concession stand, you don't want everyone picking the same bottle to put ketchup and mustard. So those are small things that we need to pay attention to. But then, if we are confident that things are progressing fine as part of phase 4, we will certainly, as will other jurisdictions, start looking at event sizes. But again, it's not so much maybe sitting in an area with others more than 2 meters away. It's all the other activities that happen around an event where transmission can happen, where mingling happens in an uncontrolled way, that I think we need a better understanding of how to manage that.
Follow-up, Steph?
Yeah. Are you trying to bring any kind of a contact tracing app to Saskatchewan? And if so, can you kind of elaborate on when and if we might see something like that, at least piloted here, to see if it's...
I think discussions are underway within Saskatchewan, and we're also looking at evaluations from other provinces and other countries. And certainly, of course, we understand that countries who deployed that more broadly in the Southeast Asia had more success because it was used by a broader number of people. I know in Europe and North America, even when apps are deployed, they're more voluntary, and only a few people will download. So I think while they're useful, they don't really resolve the issue about who was close to whom. So I think we need to look at some of those things about what's feasible in Canada and in Saskatchewan before moving further on this.
Take our next question on the phone line, operator.
We have Allison Bamford with Global.
Hi there. Just given the advisory in PA, and then I think earlier this week you had said there was a lack of testing in Prince Albert, just people with mild symptoms aren't choosing to get tested. I'm just wondering if the province is looking at either mandatory testing or doing something in the region to increase testing.
Yeah, so we actually looked at testing rates in PA area, and they're actually comparable to other parts of Saskatchewan. So it's not that no one in the PA is going testing. I think the testing rates are similar to other parts of Saskatchewan, but because we had hospitalizations with no known links to any exposure settings, we are encouraging everyone in the PN area, and that really is true for everyone in Saskatchewan, that even if you have mild symptoms, and we know that as summer came, our overall testing numbers went down from around 700, 800 a day to around 400 to 600 per day. But we do want to encourage everyone, and especially in the PA area, that even if you have mild symptoms, you're otherwise fine, do go for testing, because that lets a better understanding of is there community transmission and how to control that. But I think testing is happening in PA at an appropriate level, similar to other jurisdictions. It's picked up in the last week, with the communications going out to the public and improving access to testing at different areas within the PA area, and that's actually testing, as well as the fact that contact tracing has generated more than 100 contacts from the 6 cases, and as they are followed up and may require testing, we'll certainly either be reassured that there isn't large-scale community transmission or understand if that's happening, what are the settings, and be able to provide further guidance. So we'll obviously be updating on that over the next few weeks.
Do you have a follow-up, Allison?
Yeah, I know, Dr. Shahab, you said what's happening in PA right now is it's expected to kind of happen in other communities across the province as this continues. I'm just wondering, I guess, what would need to escalate or happen in these certain communities for more restrictions to be in place? Like, I know restrictions for visitation in the hospital in PA right now,
Yeah.
but what would be like kind of the next step?
We are looking very closely at other jurisdictions, primarily in Australia, Southeast Asia, Europe, where they had a much higher surge than we ever saw. They went out of that surge, and now they're seeing increase in transmission as they've opened up their economies, and they are applying restrictions at a more local level, either full lockdowns or specific interventions based on the transmission risk, and really, our preference would be that we don't go into full lockdown even locally as much as we can. We try to get a good understanding of what are the transmission risks, and that's when we need to focus. For example, if transmission risks continue to be small gatherings, at home or otherwise, which seems to be a very common transmission, and many of us go to those than other events, for example, maybe that's where we need to focus. So I think we need to watch closely, understand transmission risks, and either update the guidance or clarify that if the guidelines are not being followed, they should be followed. And for example, throughout Canada, funerals seem to be high risk, and again, it's an emotional event. People are grieving. People may be compelled to hug, get closer to people who may not be in your virtual household. It's a difficult situation, but that's where transmission does happen. So again, just that ability to maintain that physical distancing, which is very difficult in times of great grief or joy, and I think that's the approach we want to take. But certainly, we had travel restrictions in the Northwest, which have now been lifted, and certainly if there were a need for specific interventions beyond general guidance, I think they would have to be considered.
We'll take another question on the line.
We have Mark Smith with CTV.
Hello. Further to the last question, with multiple active cases now in every region of the province except Regina, is there any concern that this is a trend with more now reopening around the province?
Yeah, so I think we all knew that we will see some increase in cases. And at the moment, I think, we are overall, watching carefully, re-emphasizing, the things we should all do in terms of, I just showed the, re-emphasizing the basic things all of us should do, and hope that by just continuing to do what we've been doing so well, we may see cases throughout the province, but we can keep them at a low number. But I think it's well known that as we increase our social mixing, because we're opening up for work and leisure, we will see more pop-up cases. But if we have small number of contacts, we isolate when we're ill, we seek testing if we have even mild symptoms, and we practice physical distancing all the time. Hopefully that will remain low. But I think we need to watch closely and intervene quickly before things start escalating in any specific part of the province.
Do you have a follow-up, Mark?
Yes. The 2 new cases in the south today, were those linked to the outbreaks in the Maple Creek area?
I don't have updated information, but I think they are not linked directly to the outbreaks, but they are in the southwest and west central parts of the province. But as we investigate further, we can provide further updates. But again, most cases continue to be sporadic cases, and some, of course, are linked to specific outbreaks. But I don't have that detailed information at this time.
We'll take our next question on the line.
We have Lisa Schick with CJME.
Hi, I am just wondering when there's a case or cases found at a business, is there a responsibility or guidelines for them to do things like close or cleaning for anything? How long would they have to close? And if they don't do that, is there any liability on them?
Yeah, so public health works very closely with all kinds of businesses, and really it depends on several factors. So, for example, if someone was not at work and became symptomatic, and public health was able to confirm that they were not at work while symptomatic, there's no issue for any case contact investigation or follow up at the place of work. If someone was working in an area where there were just a few other employees, routinely there's an assessment made that were all employees or only some close contacts. And if they were, they're just given some general information, or all employees are given some general information. And if someone was a close contact, that close contact may also have to isolate for 2 weeks and seek testing if they're symptomatic. If someone was was either working or visited in an area where other members of the public were visiting, then if there's no way to contact everyone who may have gone to an event, then a public service announcement is given, and that's just to say that potentially if you went to these businesses on these dates because someone else was there, you may have been exposed, but the risk generally would be low because we already learned that we really don't see transmission in retail environments, so the risk generally is low, but there is a public service announcement given, just for awareness. And we've seen even with air travel, for example, that we always announce flights. But, and again, this comes to the airborne question that, aircraft have very high air exchanges. So even though we always announce flights and all that, I'm actually not aware of any transmission that's happened to date in flights due to someone who was infectious while traveling. So I think that's a positive thing, and especially if people are wearing masks while traveling, for example, transmission risk is low. But there's some intent to inform the public that they would have been in an area where there was someone who's infectious. But again, if people are maintaining that 2-meter distance, hand washing, wearing a mask, if they can't maintain the 2-meter distance, the risk of transmission goes down even further. So even if there is a PSA, you need to be aware, but chances are if you're complying with everything else, your risk of exposure would be very low. And certainly we have not seen transmission in a lot of those settings in any case. Transmission is a function of how close you are to someone, how long you are close to that person. For example, in a social setting at home, you may be together for hours, around food and drink. So those are the settings where transmission risk is higher. And if you just pass by someone even closer than 2 meters, passing by someone in an aisle, for example, generally the risk of transmission in those settings is much lower.
Do you have a follow-up, Lisa?
Is there anything incumbent on the business itself, though? Like, are there requirements for them if there are cases found connected to the business, or if an employee is found that that was, I guess, symptomatic when they were at work? Is there anything that the business has to do, such as closing or such as doing a full cleaning? And if they don't do those things, is there any liability on the business for not doing them?
So public health is involved with the businesses whenever there's a case associated with a business which may be closed to the public or open to the public, and it really depends on the setting and what the person who may be a customer or an employee was doing. And so appropriate steps may include cleaning. Generally, closing a business is not required, are taken. But certainly, generally, we know that the virus may live on a surface, and that can be cleaned very quickly. And that's not really the setting in which transmission happens. Really, it's close face-to-face contact. But because COVID is a notifiable disease legally under the Public Health Act, public health is always involved and works with businesses, and the decision to issue a public service announcement is a public health decision, not a business decision. But again, I have to emphasize that, and I said that earlier, that individuals or businesses or communities sometimes feel quite under the microscope, and I think we need to get over that now, because COVID is not an unusual emerging illness like it was in March. It's something that many of us will unfortunately get exposed to over the next few months, and we need to keep our case numbers low. If we are exposed, or if we are at a business, or we run a business where there was a case, we just need to deal with it in terms of if there's a need for public service announcement. There shouldn't be any stigma or shame or finger pointing in this. It's just one thing that, just like we do with other infectious diseases, it's something that we have to normalize for the next little while, that we just need to go through the processes to make sure everyone is safe and everyone is informed. And we shouldn't treat COVID differently than we do with anything else, E. coli infections or measles infections. We just need to have the same approach, really.
We'll take one more question on the line.
We have Peter Lazinski from the PA Herald.
Hi, doctor. We've heard several people in our region expressing not following the recommendations, but also expressing doubt that what is being said and reported is even happening. One is with the person who in their 20s who was unfortunately pronounced deceased earlier this week. People saying that they knew them or it wasn't really a COVID-related case. I know you're restricted by privacy legislation, but if there's anything else you can provide in terms of background on that case, even just in how a determination is made that a death can be attributed to COVID-19, or if they might have been presenting with other symptoms, or even if what region of the north they were from.
Yeah, so I won't speak to individual cases, but certainly the timelines are such that we do announce hospitalization deaths in almost real time, and certainly over time with further investigations there may be some changes to numbers in terms of hospitalization and deaths if through further evaluation COVID was not the primary cause of an hospitalization or death. But generally, if you obviously have respiratory failure due to COVID and no other illness, that's pretty straightforward. But if you have other comorbidities or illnesses, sometimes it is difficult to sort that out in a short period of time. But for transparency, we do announce hospitalization and deaths in near real time. But over time, some of those cases may get adjusted. We also know that, and I said that earlier also, that we already know that, while we obsess on case numbers, we know that especially if you're younger, up to 20-30% of individuals may actually be asymptomatic. Many people may not seek testing, so our actual cases are probably higher. But certainly we need to track not just the case numbers, but hospitalizations as well, because that gives us an idea of how much transmission activity there is. And that's why we have a bit of a concern around PA, because there were 6 hospitalizations after many weeks of no cases at all in the community, in the community setting. And we need to allow the public health investigation to conclude to see if there was, if this was just a coincidence or if there was community transmission that hopefully will be detected and addressed.
Do you have a follow-up question, Peter?
Yeah. What is the advice, again, just to reiterate, what is the advice given to people in Prince Albert? What should they be doing? Should they be seeking testing? Is it just to make sure they're following public health advice? What is the advice as this cluster of cases in the region is detected?
So the advice really is the same for people in the PA area as it is for everyone. Enjoy the summer, but while you're out and about, practice physical distancing. Stay home if you're sick. Don't go to that birthday party or that funeral if you're unwell. And then if you have any of those symptoms, it could even be a headache or a cough or a mild sore throat. Do seek testing, because that informs you, it informs what needs to happen for your close contacts, and also informs everyone else in terms of is there COVID activity that we need to be aware of. So I think the advice really is the same for people in PA as it is for everywhere. And so and these things will continue to happen. I think right now it's PA. We may see a bit of an increase in any other part of the province, and same, a bit of a focus will be there just to make sure that everything is fine, or if there's some increase, just appropriate precautions are ramped up, or the capacity for testing is ramped up as required. But certainly currently there's adequate testing capacity. There's adequate capacity to follow up cases and contacts. But again, we have to remember that right now it's summer and we need to get used to this. As we get into fall, the cough and cold season, we will certainly see more concerns and more need for testing, where again what we saw in March, April was that even when we had a bit of an increase in cases, 99% of the time, the test was negative. Our test positive rate has been around 1%, which it still is. So, and that's fine as well. 99 times when you have symptoms that could be COVID or another cough or cold, your test is negative, which still means you should remain at home, because sometimes with mild symptoms the test can be false negative. So you should still remain at home till you're asymptomatic. But in most cases, it may not be COVID, but that still doesn't mean that you shouldn't get tested, because if you are positive, then there's, it is important to make sure that your contacts are followed up and are aware and seek testing if they become symptomatic as well. And that's how you break the chain of transmission.
Thank you, Dr. Shahab. Thank you, everyone, for taking the time to join us today. That concludes our conference.